If there's anything I can do that will protect my kids, I'm gonna do it.
And Betsy Magley will forever be grateful that her trusted healthcare provider suggested that when her 3 kids became preteens, they had to be HPV vaccinated.
My pediatrician suggested it, and anything that will give me a chance to inoculate my kids against any kind of cancer, I'm going to take it.
With 3 children, Nathan, Zoe, and Aiden, I don't know if all of my decisions have been good as a parent, but I'm confident that having this vaccination was one of the better things that we've done.
Even the Magley teenagers, yes, teenagers, go along with their parents on this one.
I'm 16, no questions asked. You have to protect yourself. If you have that choice, make it.
Well, I mean, it was kind of like any other shot. It hurt, but you're glad you do it once it's over.
But the experts will tell you, as they tell parents, providers, and anyone else, the HPV vaccine protocol is not like any other shot. It's a vaccine that actually prevents cancer. HPV can cause any number of cancers, including cervical, throat, anal, penile, vaginal, and vulvar.
I was stage 4 at the time that I found out.
And lucky to be alive today. HPV was the direct cause of John Rhodes' throat cancer. The former Duquesne University assistant basketball coach and fierce competitor himself faced a frightening prospect.
I was stage 4 at the time that I found out. It was something that was treatable as well as being curable.
But while John Rhodes is grateful to have survived, the treatment and recovery were no fun, and the effects of surgery will linger for the rest of his life. He can't taste food, and his speech patterns have been compromised. Mr. Rhodes says if the HPV vaccine was available back then, when he was a younger man, given what he knows now, he would have done anything to get the shots.
For me, when you talk about cause and effect, I went from having a sore throat to having a little bit of discomfort to being stage 4 in an incredible amount of time. But if I would have had a chance when I was a teenager to take a shot that may have prevented, I would have stood in that line for as long as it took. And I would never wish this on anyone.
Every child should be vaccinated.
Dr. Jonas Johnson is chairman of the Department of Oncology at the University of Pittsburgh. He's devoted his life to caring for patients with throat cancer. His message to healthcare providers, parents, all of us, is straightforward, direct.
HPV-related throat cancer can be prevented either by avoiding HPV or by being vaccinated. So the problem with avoidance is it almost doesn't happen. You get HPV from other people, and since almost all of us become involved with other people, we are all going to be exposed. The cancer it causes is treatable. The treatment is very, very toxic. So the kinds of problems people get are they lose their sense of taste, they lose their saliva, and then their muscles become stiff. And as your muscles become stiff, you are uncomfortable because your neck and shoulders hurt. You have problems eating because your mouth won't open, and you have problems swallowing.
The Jewish Healthcare Foundation got involved with HPV. We were very happy to do the things we can do well, which is convene people, to work with the media, and the media have been wonderful in getting the word out, to try and form an alliance that would get the health plans and the health systems to encourage their pediatricians to please have these conversations and urge parents to vaccinate their children.
Pediatricians like Dr. Jeff Ubinger, who with the support of the Jewish Healthcare Foundation, the research and the proven success of the vaccine, joins the overall medical provider community to push the truth and proven outcomes.
As a provider, I feel like it is my responsibility to give good, up-to-date, correct information on a vaccine. Again, this is a life-saving vaccine, preventing cancer and therefore saving lives. So yes, it is our duty to educate.
I definitely recommend it from a personal perspective. I actually had it when I was 22. They were giving it away for free at the health department when I was in college, and they just said that it prevented cancer, and that's all I needed to hear, and I got the vaccine. So I usually just explain that from a personal experience, I had it. I didn't have any side effects or problems, and I still haven't.
But given remaining parental apprehension, the push is even more critical now, says family physician Dr. Ellen Finkelstein.
So one of the things I tell parents to try to reassure them is I have 2 kids. My kids are now 18 and 14. This vaccine is recommended at age 11 or 12. When my kids were younger, when they were in 7th and 8th grade, and it was time for them to get this vaccine, I made sure that it was one of the first things that we did to take care of them when we took them to their well child visits. And I tell parents that this is something that I've done for my children because I think it's important, and I wouldn't want anything less for your children.
Pediatric nurse practitioners are on the front lines. Brenda Cassady coordinates the nurse practitioner program at the University of Pittsburgh. She urges nurses and all providers to guide parents with the facts.
I start with asking parents if they have any concerns about it. I also make sure that I say the vaccines that your child is due for include the Tdap, the meningitis, and the HPV vaccine. They are all equally recommended. And so it's important to talk about the vaccine and any concerns that you have if you're hesitant to give the vaccine.
This is not something that we can revisit in 10 or 15 years and say, boy, I wish we would have thought about that. And with nephews graduating from college, their friends struggling with cervical cancer that didn't have this opportunity, I think this was a good idea.
Of all the cancers we treat in the head and neck, roughly 1/3 are attributable to HPV today. This is not necessary. These cancers can be prevented.
There's no doubt, there's no what if. It's very clear from the medical community that this vaccine prevents cancer, and it's the right thing to do.